One, two, three. Hello. Good morning. I'm testing the mic. Okay. One, two, three. Hello. Good morning. I'm testing the mic. So, Apnil, you started the recording?
Yes, sir.
Okay. Uh, okay. Good morning, all. Nice of you to join on a Monday morning. Normally, in gyms, Monday morning is always a busy time, no? When people have a wonderful time on Saturday, Sunday, now they want to come and lose their fat or wash away their sins on Monday morning. So Monday morning is busy for personal trainers. And thank you for joining. There are a lot of people who I think were supposed to join Guwahati and Assam, but they're finding it a little difficult, but that's okay. They will always get the recording of this particular
Good
show
morning.
on YouTube. Hi, Dr. Lee. Is that Dr. Lee? Hi.
Yes, I'm here.
Okay, wonderful, wonderful. So let us start by welcoming Dr. Lee CP, the famous legendary Dr. Lee from Kuala Lumpur. And he's already been to India once. And although he is very much in Malaysia, as the name Malaysia suggests, it's all part of, a microcosm of the whole of Asia. You have Indians there, Tamilians there, Malayalis there, uh, Punjabis in Malaysia, and of course, people of Chinese ethnic origin, Malay origin, and so on. So I think that's the reason I wanted Dr. Lee to come to India and teach his particular course. But before we get into that course, we need to know what is he going to teach and how is he going to teach. Now, once in a while, maybe once in 4 or 5 months, we have this YouTube, this program called Rendezvous with the Gurus on our Gaio Fitness Academy YouTube channel. It's a small fledgling channel. And the last time that we did a similar rendezvous was with the famous legendary professor Ian Jeffries, the strength and conditioning guru, which was exactly a year ago. And after that, of course, now we have the guru from Malaysia, Dr. Lee CP, with us. So before we get into the thing, what we need to say is admit. So Apnil, will you be able to manage the admitting?
Yes, sir.
Dr. Lee proposes to do the specialist in exercise medicine program in September and November in India. That is Bangalore, Guwahati, that's Assam, and Thrissur in Kerala. And we'll also be doing the same course in Dubai, November, January. So now there's a lot of, not, I won't say doubts, but there are a lot of questions that people want to know about what is exercise medicine. And how will it help us, for example? So that we'll go step by step, slide by slide. I'll present only 5 or 6 slides, after which Dr. Lee will explain his course to us. And at the end of that, I would like the students to ask him or me the questions. Now, in June, when Dr. Lee presented this exercise medicine program in Mumbai, it was a 5-day course. And we decided to split up that course into two for 2 reasons. Not many fitness professionals or even physical education teachers can give 5 days at a stretch. Employers don't give leave. Even in Dubai, I've seen the same thing. Nobody wants to give leave for their trainers to go and attend this course. So we split it up into 2 parts. The first, clinic number 1. Clinic 1 is 3 days and clinic 2 will be 2 days. The other benefit is, of course, students can make the payment in 2 or 3 installments, right? If you make the attend in September and November, you can make the fee, pay the fee in September, October, November. So what earlier you had to pay in advance now can be done in 3, and who doesn't want installments? And we don't charge you extra interest on it at all, right? Swapnil, will you manage that admitting thing? Okay.
Yes,
So,
sir.
Okay, so now we come to introduction. Why do we need exercise medicine program or some program to help patients with non-communicable diseases or other diseases to come back to normal? Especially after COVID, you would have seen that the number of people who have been complaining of all kinds of diseases, all kinds of medical conditions has increased. Now, they may not have increased in numbers, but we are definitely hearing more of it because people are more honest about their own illnesses. I remember long back in Kolkata, one very famous businessman said, nobody should know that he was a patient of hypertension. This was 5 years before COVID, but now he openly talks about his hypertension problem. So people are getting used to talking about their own health, and that itself becomes some kind of a therapy. The point that I want to mention is I will not get into the role or the contribution of the negative, the evil contribution of NCDs to global deaths all over the world. Basically, if you look at it, I mean, there are 41 million people who die every year because of NCDs. But for me, more interesting is in the context of India. In India, there are some non-communicable diseases that are more common. For example, cardiovascular diseases, chronic respiratory diseases, cancer, of course, and diabetes. And interesting, in India, 60% of all the deaths are because of NCDs. 60%, that's not a small amount. Now, 60% translates to nearly 6 million every year, right? So I will not get into the figures, the statistics. After all, we are not playing cricket or something that I need to give you statistics. But suffice to say that after COVID, people have become more health conscious. Number one, I've always been saying there are two types of fitness. One is health related fitness, and the other one is sports related fitness. Strength and conditioning, bodybuilding will go into the sports related fitness. While health related fitness is not only the regular personal training, but also fitness for special populations. And that is where Dr. Lee and his exercise medicine comes in. Now, Dr. Lee has just joined us. This young, handsome man from Kuala Lumpur is a very famous man. He is considered to be a pioneer in using exercise as a non-pharmaceutical medicine. Medicines normally are drugs, right? It could be an aspirin, it could be dispirin, it could be, antibiotics. They're all medication, they're all drugs. But here is a person who says that exercise can be used as a non-drug medication for managing illnesses or recovering out of medical condition, especially non-communicable diseases. Now, somebody asked me, what is this non-communicable disease? Well, it means that you cannot infect somebody else. If I have obesity or hypertension, I cannot give you hypertension or obesity if you're sitting next to me. That is one part. But NCDs are basically also would be known, some of them or most of the NCDs would be known as hypokinetic because of sedentary lifestyle, our lifestyle, smoking, for example, alcohol, whatever it is, stress at work, stress at home, stress while during traveling. Now, there are actually, if you look at it, there are nearly 50 illnesses which come under the NCD category. Broadly speaking, you could say they are cardiovascular, they are metabolic, they are musculoskeletal, there are pulmonary, and of course, there are neurological. The skies, it's a huge number of, let me admit this. Okay. So now the question is, before we get to what Dr. Lee is going to teach, let us look at his credentials. For one thing for sure, he is from Malaysia, as I mentioned at the beginning. Malaysia is a mini Asia. So when he developed his experience, he has worked in a sense by working with patients of all ethnicities, including Indians, Tamilians, Malayalis in Kuala Lumpur. He has developed a unique kind of an experience which no American or no European specialist can give us. He's very, very Indian, very, very Asian to that extent. But where does he come from? He did his PhD in sports sciences from Budapest, that's in Hungary. To our bodybuilding students, Hungary is a country from where our great Bernard Scoras comes from. He is a research scholar. He has pioneered research on the heart rate return to prevent sudden death It's very fascinating. And certain deaths can occur even in exercise, during exercise or playing sports. He's also the chief executive of his baby called the Asia College of Exercise Medicine in Kuala Lumpur. He is associated with a range of international bodies. In January, much before he came to deliver his exercise medicine course in June, in January, last January, he was here to, he participates in a lot of international conferences across India. In January, he comes back to Mumbai to participate in another international conference. I'm sure he goes to Delhi. He'll also go to Chennai and so on. So he's a very busy man. He keeps traveling quite a lot. So the point that I wanted to make is that Dr. Lee is the right suitably qualified to deliver exercise medicine in the Asian, in the Indian context. That is very important. There's no point in somebody telling me what is happening in America because that culture and their anthropometrics are quite different from ours. Now, the next point is what are the course credentials? I'll quickly summarize them so that Dr. Lee can then speak on this. As I mentioned, he is a pioneer on using exercise as a first line of intervention against NCDs. And the college that he looks after is fully accredited by the government of Malaysia, right? That's the course credential. So when he gives a certificate, it will come from his world famous, internationally accepted college. Like the June course in Mumbai, we will also get NACA CEUs for this course. But there's a slight difference. Let me make it clear right at the beginning. And the difference is this. The 5-day course in Mumbai got 2.0 CEUs in category A. I'm talking of National Strength and Conditioning Association. But this time the 5-day course has been split into 3 days plus 2 days. So naturally, they will also split the CUs in that fashion. It could be 1.2 for one and 0.8 for the other one. That today, I think today or tomorrow, I will get the approvals. But rest assured that NACA has given the CUs approval for this. Secondly, ISSA will give 18 CEUs for the 3-day course and 12 CEUs for the 2-day course. So it is internationally accepted as far as I am concerned. How will this course be delivered? In fact, Dr. Lee and I have been discussing this over the last, we play table tennis or ping pong through WhatsApp. I send him a query, he answers, then I know vice versa. It's like ping pong going on. Basically, it is offline. Now, somebody asked me, why is it offline? Can we do it partly online? That, of course, the students can ask him later on. See, the thing is, just as you cannot become an MBBS doctor by doing an online course, similarly, because you are dealing with NCDs, medical populations, special populations, you need to do, for example, fitness assessment hands-on, right? Now, there are so many fitness tests that all of us know. In fact, in our Guy Fitness Academy, we keep teaching a lot of fitness assessment tests. We even have videos for that. How to take the measurement, for example, the chest measurement, there's a way you stand and take the measurement. That all our students know. But then what is this new thing that Dr. Lee is going to teach us? That he will explain to us a little later. For me, what is important is it's a physical offline thing as of now, but the learning outcomes are important. What are you going to get out of this course at the end of the course? You learn or you revise or you get new insights into strength physiology, that's strength training, weight training. More importantly, prescription of resistance exercises, which all of us know, but we mostly practice exercise prescription in the context of people who have no medical conditions. You and I are lucky that we don't have medical conditions, but a lot of people who unfortunately have medical conditions. So he's going to speak or share his experience and wisdom in the context of exercise prescription in the right dosage. If my doctor says take 1 tablet in the morning, I have to take only 1 tablet in the morning. I cannot take half or I cannot take 2, right? Like a doctor gives you a dosage for each medication. Similarly, Dr. Lee says that when you prescribe the exercises to the NCD patient, there has to be a dosage. And that is what he teaches most. That's one of the unique points of his program. How resistance training and weight training can be used to treat NCDs and cancer. And the dosage, of course, as I mentioned, that's very, very important. I mean, a diabetic do 3 sets of 15 reps or 2 sets of 12 reps. That is those nuances is what he's going to share in his program. What are the learning experiences, learning resources? What are you going to get? Of course, you are going to get a soft copy of a training manual. You'll get a small oximeter. Well, everybody has an oximeter in the house, right? Thanks to COVID. But how do you use it or how do you really analyze it? That's more important. He will also explain to you the use of a skin fold caliper. He's going to give it to you complimentary as part of the fees. A skin fold caliper, a measuring tape, an oximeter, a soft copy of the training manual, or a set of booklets, actually. And very interestingly, what I think is the best is one account for his Dr. Fit software for physical fitness assessment and so on. That I will request Dr. Lee to explain what this Dr. Fit is all about. And of course, it is not part of learning resources, but yes, since students will be traveling a bit, we'll give them light vegetarian lunch. It is not a learning resource, but it will definitely help you digest the learning knowledge, resources and the knowledge. So we go to the next point, and this is who should attend this course? Well, mostly here people are personal trainers, so I should mention their names, personal trainers and fitness professionals first. Physical education teachers. Physical education teachers. Now, there's a lot of reasons for it. In fact, that is the reason why Dr. Lee and his college have tied up with our education partner, BPCA College of Physical Education. Physiotherapists can join in. Physiotherapists are very good at rehabilitation, but they're not very comfortable or naturally, it is not their function with the exercise part of it. Doctors can join because they're very good at the physiology and the pathology of the medical conditions, but they are not good at the exercise part of it, right? So there are a lot of personal trainers I know, probably because their age is 40 plus. If they're young, 20, 25-year-old, 30-year-old personal trainers, they rather train people in the gym, people like in the middle ages. But as the personal trainer himself increases in age, he would rather deal with citizens like me at about the age of 70 and so on, right? So there are a lot of personal trainers who want to deal only with special populations because that's a big market and there's no competition there. There are thousands of personal trainers in India, but very, very few personal trainers who would like to train people above the age of 60, or people with NCDs. So the market is big. The supply is there, demand is very short, so it's good, very good marketability for you. There's no competition there. And of course, it's a good money also. Strength and conditioning coaches who can work with special population. Now, somebody asked me, one sports coach asked me, sir, why should I do exercise medicine? I don't deal with people with diabetes or heart problems. But the point is, he was talking in terms of national and international football. What about the youngsters who play in the school? School children have non-communicable diseases, obesity, for example. Some of them can even have heart issues. What about in a typical gymkhana, as we call them, gymkhana or a club? Where people play squash, badminton, cricket, tennis. Many of them are also uh, suffering from NCDs. So a strength and conditioning coach doesn't have to train only competitive sportsmen. There's a huge market in schools, in clubs, in gymkhanas, anywhere else for that matter. Even residential societies. I know of a residential gated community in Yalanka in Bangalore, where they had a strength and conditioning coach for 30 young children from that colony, residential colony. They had a qualified basketball coach and they had a strength and conditioning coach. It's interestingly in a residential cooperative society. So strength and conditioning is not only for Olympics, and because most of us tend to, no, I want to train only an Olympic athlete. No, that's not how it goes. Once you do this course, you get a certification from the Asia College of Exercise Medicine. The course signatory to that will be the BPCA College of Physical Education. Okay, because they have a MOU. While Gavi Fitness Academy is just a facilitator, we will try to bring the best practices to India, just as a way we keep bringing Kim Maripolin or Gemma Quinnell or Professor Ian Jeffries to India. Same way, we would love to bring Dr. Lee to India. The last slide before I hand over the mic to Dr. Lee. We planned, these are the tentative dates. We would love to, we are confirmed from our side. Now let us see how things pan out in the next few days. Bangalore clinic will be September 2021-22. After that, if things go well, we'll go to Guwahati 24-25 and Thrissur 27, 28, 29. That is in the month of September. I have not added the Dubai dates here because we are in India, so that Dubai dates are subject to reconfirmation, depending on how things pan out in India. In November, he will again come visit India, go to Bangalore for the 2-day clinic tour. Guwahati will be the 3-day clinic, and Thrissur will be a 2-day clinic. Dubai, I've also mentioned the dates are subject to confirmation, especially in November, but that is between me and Dr. Lee and our team in Dubai. Now, the students who attend both the clinics 1 and 2, will get a specialist in exercise medicine certificate issued by the Asian College, the Asia College of Exercise Medicine, and perhaps co-signed by the BPCA College of Physical Education, University of Mumbai. So the value of that certificate is very, very, very high. Okay. Those who are NACA certificate holders will get a CU certificate at a nominal fee, extra fee, because when I got the NACA CU's approval, I had to pay X dollars to the NACA. So I need to recover that. That's not a profit making, but whatever is the cost on actual basis, the student will pay me. ISSA is, as I mentioned to you, 18 CUs for the first clinic, the 3-day clinic, and 12 CUs for the 2-day clinic. So this is where I stopped my little spiel about exercise medicine. Dr. Lee, I would like you to come in and explain first and more. I'll ask you the questions. Can you hear me?
Yes, I can hear you very clearly.
So my question to you first, I mean, by way of a general discussion, at the end of which, if there are any questions, we will take it from the students or the participants. What, according to you, is exercise medication?
Okay. First of all, I'd like to say thank you to everyone for attending. And Mr. Dilip, thank you for this session.
God bless.
I have to admit, I'm actually in the cafe. I was actually working from the Putrajaya, the central of our government agency, where I attended a meeting at the Ministry of Health, as we are now presenting the use of exercise medicine to curb the expense of diabetes that costs our country $2 billion a year. So I'm working on that now with the ministry. Now I have a few slides to show you on what exercise medicine is all about.
So 1 minute. Swapnil?
Yes.
Swapnil?
Yes, sir.
Can you make Dr. Lee the co-host?
Yes, sir.
Should I back?
I did, sir.
Thank you. Okay, Dr. Lee, you are the co-host now. You can share the PPTs.
All right. If you can look into this, can you all see the slides? I'm sure you can, right? So
yes, we can see it.
All right. Let me tell you a little bit of history, story of it. In 1987, most of you are not born yet, I'm sure. I was in the United States. I was looking for Joe Weider in the Mr. Olympia team, as well as the muscle and fitness camp. And over there, I was exposed to many new technologies. And one of the interesting technologies is that we met a couple of doctors, Dr. Thomas Peters, and he was telling to me that the future of exercise will turn medicine. That was 1987. And sure enough, as the evolution of fitness goes on and the exercise goes on, we have to be honest about it, because the great foundations of the exercise world has been shaken, especially after the MCO, the pandemic. The old ideas and institution has crumbled. It has crumbled, and the new generation is called upon. That's you to remake the world, because chronic disease is killing mankind. It is the #1 killer. If you want to talk about market pie in exercise medicine, across the world, mortality rate is 41 million. If you're good in exercise medicine, there'll be 41 million people for you to cure every year, because these are the people who die. All right, so exercise medicine was brought to Malaysia about 14 years ago. It was approved by the Ministry of Health. We have exercise clinic practicing exercise medicine together with the Ministry of Health, health clinics, where medical doctors will send patients who have contracted this chronic diseases, NCD, that is high blood pressure, diabetes, obesity, hypercholesterolemia, certain kind of cancer that we are looking into. So that's why we call it exercise medicine, the prescription for chronic diseases. Now, see how that the next one. What is it? All this exercise medicine about the type of exercise prescribed in exercise medicine. You look into it here. There are only 3 types. One is the resistance training, aerobics, and stretching, and all these are done indoor. As you all know, the adherence to exercise program is always very bad. I'm sure if you guys have been in the fitness industry or physical fitness educators, or you're a certified personal trainer, you will see all kinds of excuses. If you were to run outdoor, you complain the weather, you complain that you get bitten by the dog, and you go outdoor to exercise, you get mugged, and then bad pollution air. So we design exercise in a sheltered environment. And these 3 exercises will be resistance training, aerobics, and stretching. It was designed in such a way that it simulates exactly how a gym workout is. And how we have looked into is that when we designed exercise medicine back 15 years ago, we want to follow exercise medicine as conventional medicine. If you look into the modern medicine and conventional medicine, they have a standard protocol. They diagnose the patient, they prescribe the medication. That's the end of it. And then the patient, they come to see the medical doctors, they will take the medication as prescribed and advised by the medical doctors, or they go for surgery. So which role are we going to play if we are the exercise medicine specialists? We will play the doctor's role. So in somehow, you are going to be called as the exercise doctor. So in our exercise medicine protocol, the first thing we have to do is to make sure that you do a correct diagnosis. Like medical doctors, in our part, we look at it as an accurate assessment process. We assess the physical part of it and the health part of it. So once you have performed all this, what we want to do is that we do not do it on a manual basis. We key it into the Dr. Fit software that is designed by me in 1987, and it has been translated into 3 languages now, and it's gone across the world. One of the reasons that we use this software is because it will be accurate, it will be very professional, and we can use it as documentation process. That means that you can compare the first assessment to the second assessment, right? So, and it also auto-generate a set of 6 symmetrical dose of exercise. If you look at here, it shows you that this is a program of diabetes. The key factor of this will be to eliminate human emotion. Why do I say human emotion? Because there's a lot of PTs or fitness instructor in town. If the client comes in here, you don't seem to like her or him because he raised his voice a little bit or being too frank, you will torture your client with your program, which is not fair. But anyway, it happens. I have been a fitness instructor for many years, since 1984. And the exercise that you prescribe, it has to be to specific conditions, right? Specific conditions means, are you treating them because of diabetes, or are you treating them because of hypertension, or are you treating them because of certain cancer that is going through chemotherapy? And the program must be correct dosage. You do not estimate looking at the size of the client and tell them, you lift this dumbbell for 3 kilograms, 5 kilograms. And I can assure you that over the years of your profession as a certified personal trainer or whatever, that when you give an exercise to your client, nobody would dare to ask you, why 3 kilo and 5 kilo, right? But if you dare ask you, you will tell them that, well, I think you are able to lift 5 kilo. I think that's the most common answer, all right? But if it is science, there's no guesswork. It has to be very accurate. So the dosage must be correct so that you do not waste time. You do not waste the client's time, and you got to make sure that what they pay for is worth the while. And of course, the last part of it is the precautionary area. Precautionary area means here you have to make sure that whatever you give them, it has to be measured that if they have low back pain, there are certain positions that you cannot allow them to do. If they have vertigo, there are certain positions you cannot allow them to do. So these are precautionary things that you have to take care. This is in terms of our second protocol. And lastly, the key factors is you have to correct exercise instruction, right? That means you got to make sure that when you teach this person, the exercise do not cause strain, pain, delay onset of muscle soreness, you do not dislocate his shoulder joint, you do not cause him chronic aches and pains, and due to all this, you created overtraining syndrome and overuse injuries. So these are the three protocols that we do. Whereas in modern medicine, as a doctor, they look into the patient, they diagnose, they take the history, and then they just prescribe the medication, and the medication will be taken orally by the patient. Whereas here, we have a little bit more to do. You have to show them how to do it. Whereas for medication, they just swallow it. Whereas here, if you look into that, you will need to teach them what's the resistance training, how do you get the dosage of the resistance training, and then you look into the cardio training and what you can do with the cardio training and stretching and so forth. So as a person who's going to be in this field, you have to be physically active, all right? Image costs a lot of impact. You must be with a sound knowledge on biomechanics of the neuromuscular system, the cardiovascular system, exercise physiology. So you got to have at least, in Malaysia, we call it a diploma level of education in the allied health sciences. So these are a few things that you got to have before we can actually get into the discipline of exercise medicine. So based on this, we all know that when you do exercise, what happens to the muscle, and how the muscle behave, and what do they spit out from the exercises based on the number of reps, the weightage, based on the rest between the sets, and based on the frequency over the week, micro, the macro, and so cycle, right? Of course, in cardiorespiratory, we also have done a lot of research, and we've come up with the heart rate return based on that. So basically, exercise medicine covers the whole lot of this. So to make the whole thing simple and short, if you have completed this program, you will be called as an exercise doctor, all right? Where you will doctor a patient on three things. You diagnose them, you prescribe them with the exercise, and you teach them how to do it. And you maintain and monitor the record, whether they are improving or whether not improving. Improving, there are many different aspects also. You have to look into their diet, their dietary intake, as well as their appetite, their sleeping pattern, their day-to-day working energy, and so forth. So this is how exercise medicine is. All right, you're going to be an exercise doctor, because in those days, when someone exercise is for a different objective from the outcome of exercise. Now, exercise is to treat. It's to treat diseases. Now, when I was a fitness instructor back about 40 years ago, many of my clients has improved a lot. But when they wake up on the wrong side of the bed, they will say, "Hey, Lee, I've been with you for the past 2 years. I don't see any changes." You see the body change and evolve slowly, and you couldn't find the changes yourself unless you measure them and give them a very accurate comparison. Say, you came in with this poundage and you are on this poundage. There's nothing to argue, right? This is the first thing. So I am so sick and tired of these things blowing onto my face every day for many, many years. And then I find that people come in here, they do not adhere to the exercise program. But I do realize one thing is that they never fail to listen to the medical doctors. So that's how I wanted to develop it. So I spent about 4 years in the United States, and I spent about 32 years in Europe. I only realized that I spent 32 years in Europe when I got my second doctorate. I went back to Europe, and then the day before of the ceremony, and I recall back with my professor, and he said, "Hey, I've been here for 30 years, which is half my life. I'm 63 this year, and I spent about 31 to 32 years in Europe." So based on that, when I received my second doctorate, I only realized that this is the time that I spent doing this research. Now, I have to tell you one thing that all these years, even in Malaysia, we always follow the American College of Sports Medicine. We always follow a lot of those norms that other countries has developed. But one thing for sure is that over the years, when I was a fitness instructor, and when I turned this exercise more to the scientific aspect, and now to the medicinal aspect, I find that those norms are not workable. BMI, it doesn't work for us.
Yes.
Calorie intake, it doesn't work for us. You know, those treadmills that you buy from the United States, from Canada, from any part of the world, it doesn't measure your calories at all, because the calories shown onto the monitor of the treadmill, it's the norms of the Americans. It is made in America. What about those in India, in Malaysia, in Singapore, in Thailand, and Indonesia? So these are the norms that we have always been carried forward. Even in Malaysia, when I present my paper, they will always tell us, you know, we follow the American College of Medicine, and then we also follow the American Heart Association. I say American Heart Association you can follow, but as far as sports and exercise is concerned, you don't follow. Because as far as it is concerned, what we can do, they cannot do. What they can do, we cannot do. All right, and the most important thing is that their food is different. All right, their sleep pattern is different. The way they think is different. The clothing is different. There's a lot of differences. So over the years, we also have created norms, and the norms have been placed into Dr. Fate. We have about 17,000 members over the years that we have created to develop the high algorithm of the software, which we are using extensively in the Ministry of Health. And of course, now we are developing the program for aging. We are hosting the International Symposium of Active Aging next month. It is being initiated by the Minister of Law in Malaysia. She's a good friend of mine. I served her when she was the Minister of Sports back in 2004. So we also move into a new discipline, which is aging now, because Malaysia is going to be an aged nation very soon, by the year 2030. So when one age, the exercise will be different, the mobility will be different, and so forth. So basically, one of the most important things that we have developed here is that the norms are different. How do we prescribe dosage? You know, I'm sure being a CPT, certified personal trainer, or a physiotherapist, or a PE educator, you would have read and maybe been taught that the American College of Sports Medicine way of determining the 1 max RM, how many percentage to deliver the poundage that you want to give it to your students or to your client. But there are so many variables that we cannot use, because, for example, if I'm new and the CPT is trying to determine what is the best poundage for my bench press, and I've never done bench press in my life before, and you want me to do a 1 max RM on a bench press, it doesn't seem right. There's no logic to it. And the other one is that you have to do 10 times, and then you multiply by 2.5 and thereby 100 to determine the rate poundage for me. It scares me off. So we have developed certain gadget when I was doing my doctorate back in Europe, and those gadgets has been using extensively over in Europe. And the other thing that in exercise medicine that you will see that when you're taught is that monitoring the heart rate. Right? Of course, when you teach as a personal trainer, when you put your client on a treadmill, I think the thing that kept you most busy will be increasing the speed, lowering the speed, increasing the speed, reduce the incline, increase the incline. The whole 30 minutes on a treadmill for your client, you'll be busy poking onto the main MCB, we call it main circuit board. It doesn't make sense, right? When you are a personal trainer or a doctor, you should be looking at the patient and spending time explaining to them the benefit of what they're doing. So we come up with heart rate return, we come up with warming up, we come up with dosage and all this. So we have also designed treadmill that actually run according to your heart rate. If it goes beyond, the treadmill automatically will slow down. The heart rate doesn't reach the targeted, calculated heart rate, and then you will increase the speed or increase the incline. So this is exercise medicine, all right? So basically, it is to facilitate and to make sure electronically and technically it is fast and very accurate that you can deliver to your patient. Now you are delivering to the sick people, all right? Because the sick people will be desperate for you. For those who comes to the gym, I'm sure that 85% of your clients, I think they look better than us sometimes. They want to look even more better. You seldom really find those severely obese or who are sick to come and see you, because I think the exercise world is more for those who are fit and healthy and they want to go to the next level. But right now, here in Malaysia, we have developed this with the Ministry of Health, that exercise is a part of a program in the ministry, and it is used as a treatment modality to treat patients. I hope these few things that I've explained to you what is going on, just to show you that how NCD is going on in this world. If you look into the, the red circle shows that until 2030, cardiovascular disease is increasing, cancer increasing, diabetes increasing, chronic respiratory diseases keep on going up. And what is going on? What is WHO doing? If the exercise world is going on so well, everybody is walking and jogging and cycling and climbing mountains, rope bike and so forth. But why are the diseases going up? There is something that is wrong, absolutely wrong. And you look into this, it's going up. Mortality has been going up since 2015, right? So something is wrong. And here, yes, it has shown so bad that everything is going up. Malaysia has been announced as the fattest country in the ASEAN region. And we are the fattest for the past 2 years in Southeast Asia. And Malaysia, we are talking about this and that, this and that. The World Health Organization is doing this and that, this and that. But why are the statistics being published by them themselves? The mortality keeps on rising. What's missing? People are exercising. The missing component here is the dosage. When people exercise, they don't exercise with the right dose. They exercise because their neighbor tell them to exercise. You read it from them, Mr. Google, to tell you to exercise. When you walk, you do not know how fast to walk. You do not know when to walk. You do not know how far to walk or how long to walk. And do you drink when you walk? And all these small things are the criteria. So if we have all those components packed into small little paper called an exercise program, that's the pill. And that pill is exercise medicine. Remember, it's exercise medicine, which is a pill. It is not exercise is medicine. Exercise is medicine is describing exercise as a form of treatment. But exercise medicine means you are prescribing a form of drugs to your patient. You have diabetes, I'm giving this drug, this exercise. And how does this drug exercise looks like? It looks like a star. This is how it looks like, all right? This is exercise medicine. So if you look into this statistic, it doesn't make sense at all. The whole world, I think after our pandemic, there are so many exercise scientists to say that exercise will increase your immune system. And the world has been exercising. My friend who has been selling bicycle over the decades and has never been making money, and now he's making tons of money because the bicycles are going out every day. But people are dying. So, if you look into all this, you will see that there are many types of exercise that's going on. And I want to show you a little bit here. How do you calculate 1 RM in ACSM? Right? So they calculate here by numbers of repetition. This is one form of it. But what we do here is that we have designed this, which is really interesting. We have developed, if you were to kick this knee extension in the isometric form, you will have a distorted spring and they amplify into how many newtons here. So it gives you 300 Newton, which is approximately about 30 kilograms. So how are you going to lift weights is that we will base on this, the maximum voluntary contraction that you do on the knee extension. And what do you want to train? You want to train neural pathway? How do you do it? You want to train your strength? You want to train power? You want to train muscular hypertrophy? You want to train endurance, you want to train aerobics, what do you want to do? So all these components that we are training is what you're going to select for your patients. All right. And these components is basically will trigger the positive adaptation. And you can choose any one of these based on what we call the cellular substrate utilization. Means what your body uses as a form of energy. Is your body using carbohydrates or glycogen? Is your body using free fatty acids? Or is your body using you're cannibalizing your own lean muscle tissue? So what are you using? We have to know all this at the cellular level to become an exercise doctors. So I know I've been blabbering for the past few seconds. There's so much to talk about. I do not know how to talk to you, but basically, in the nutshell, this is how exercise medicine you will be certified with your background and your experience in exercise teaching to become an exercise doctor. Is there any questions that are we going around this way, Mr. Dilip?
Yeah, thank you, Doc. I will just summarize what you said. Basically, three quick points. One is the exercise medicine program that you are going to present tries to keep the bias, the emotional bias out of the mind of the personal trainer. That's one. So everything is based on objective scientific principles, scientific assessment with the help of machines. Machines cannot lie. As if I like you as a client, I'll be very favorable to you. If I think I'm neutral to you, bias will step in. So that's one good point. I really appreciate that because we are all human beings. Bias has to be there, but the idea would be to try and eliminate the emotional part, the bias part out of it. That's one. Meaning, even if the client has not paid me for the last 2 months, that bias should not come in, and I should train him the way he should be trained for the management of his particular NCD. That's one point. Second, what I liked is your Dr. Fit software. I think I find that this is going to be very, very beneficial to our fitness professionals in India, because here again is something which can be shared with the client on the screen. There's no bias at all. There are certain algorithms mentioned there. According to that, it will decide what kind of a dosage the person has to go through. And I think your fee includes 1 year's free membership to that Dr. Fit software. And the third point I found personally interesting is you mentioned myokines, which are released from myocytes and so on. That's a very good point that you made. In fact, most personal trainers or strength and conditioning people will normally, or even physical education teachers, do not go anywhere in the area of myokines, myocytes, and all that. So when you cover this point in the exercise medicine course, will you also be covering things like autophagy, mitophagy, and all that?
Yes, we do. Because this is the at cellular level, we have to understand we call them, macrophages and microphages. Yes,
that's right. Because that's one thing I want to share with our students here, or the people who are here. You know what? Today, fitness and nutrition, especially, and even exercise, have gone to such a level that we don't talk in terms of biceps brachii or quadriceps or something like that. It's much far more deeper at the mitochondrial level. Normally, a personal trainer knows that a mitochondria is basically a, let's say, a cylindrical shaped organelle, right? But the mitochondria has got a hell of a lot of significance. Today, fitness is not at the biceps or the muscular level. We have actually gone down to the mitochondria level. And I think I'm not, of course, Dr. Lee is the expert. I'm just a student of all this. But last 10 days, by a coincidence, I've been studying a lot of stuff on mitochondria. It's fascinating. Mitochondria in your cell, which we think is just the engine or the powerhouse of the muscle. That's how we introduce mitochondria to our students. That's the way you will introduce mitochondria to your clients in the personal trainers here. But it's far more. In fact, it's the number of the population of mitochondria in the heart muscle, the population of the mitochondria in the skeletal muscle. They all differ and they got different functions. So when Dr. Lee said that he's going to touch upon myokines, and which are released from a cell called a myosin, it's fascinating. But that is where the illness starts, at the mitochondria level. So these are the 3 points that I wanted to summarize from what Dr. Lee said. And I think I would like participants here to ask questions. So last 10 minutes. So any questions are welcome.
Yes, sir. Let me introduce myself, Dr. Lee. Good morning. I'm Mini from Kerala. I'm the faculty of Gaia Fitness Academy. Also was an early student of it, proudly say. And I have some queries from our students, which I love to share. If you could answer it, we'll be happy. May I ask? Basically, you will be covering the NCDs in this session, right? So
Yes.
are you going to cover specific NCDs or just will you cover them in general?
We cover the NCD that has been approved by my country here because these are the things that we will follow according to the law. We will cover obesity. Obesity is no longer a risk factor; it has been declared as a disease now. We will cover hypertension. We will cover diabetes. We will cover hypercholesterolemia. And also we will cover certain aspect of the chemo part of the therapy. We will cover also on the patient support on prostate cancer. These are the few areas that we are covering. These are the most common ones that we have seen. Mental health not yet, because we really have no time to look into so many areas. But those that I mentioned are being covered. We are using exercise to support or to use exercise to treat them in Malaysia. And we are sharing it across the world now, particularly India now and also in Europe.
Okay, so doctor, I'll add one supplementary to Mini's question. Basically, what I want to know is, or what students want to know is, will we be covering these NCDs? Number one, of course, obesity you mentioned, diabetes you already mentioned, coronary heart disease.
Oh yes, I forgot that. Yes. You see,
coronary heart disease, hypertension, of course, hyperlipidemia. These are the 5 common things. Of course, in India has got its own peculiar demographics of cancer.
Yes.
For the males, it is the oral cancer, for example. For women, it is the cervical cancer or the breast cancer. So, of course, cancers are cancers. Oh my God, there are many types of cancers and cancers. So, will we be covering these specific NCDs?
Yes, of course. The NCD I mentioned, but what you mentioned, coronary artery disease or the heart. The heart is one of the areas that we cover extensively because that's why, you see, during the pandemic, everyone has been starting to exercise. Even my country has started to exercise. But then when people start to exercise, they begin to die.
That's right.
People start to die, and then the sudden cardiac arrest, sudden cardiac death is rising. And there's a lot of academicians trying to determine how. So we have been doing research now, and we found there are certain part of the body that cause sudden death, right, which has got to do with the potassium. So we have done one part of it, and we have published it into the International Cardiology Journal. We are doing the second part. We're waiting for the ethics committee for approval.
Okay, so basically what you just said is very interesting. I mean, sudden cardiac arrest or death could be because of the imbalance of potassium.
Exactly.
And potassium probably could be helped redistribute through cool down.
Yes. You see, a lot of people always focus onto the issue of warming up. But if you look into the World Cup or the Football World Cup, a team could be playing for 90 minutes or maybe 100 minutes due to extension time. But then on the 87th minute, one of the players collapsed, injured.
Yes.
The team manager will call, okay, the replacement to go in. The one who is going to replace going into the field, he cannot ask the referee to give him 10 minutes to warm up. He has no warm up. He has to run in and play.
Right.
And he doesn't die. But those who die, if you look into it, I have a lot of videos to show you. It's those who have been playing. And the reason because of this is that when the muscle contracts in the motion of the sports, and if you do not stop, and if you stop abruptly, it will cause a tremendous withdrawal of the serum potassium that triggers an arrhythmia and that kills. So
that's interesting.
There's a lot more.
Yes.
I'm an old school, so I find it very very funny to wear this around my ears and yeah.
No,
So
but it's all right because I also find that there are certain deaths that occur also in a gym.
Yeah.
Probably it could be the similar reason. I mean, we don't take cool down seriously. That's
Yeah.
the tragedy.
Yes.
Thank you, doctor, so much for your answering Mini and my questions. Any other questions?
Yes, sir.
Sweetie.
Good morning.
Sir, one more. How about arthritis? Because we people here suffer a lot from arthritis. I would like you to suggest.
You are jumping to my questions.
Yeah.
Arthritis is actually a very simple thing. You see, basically, my father has arthritis. My father is arthritic, all right, and he died because he was taking steroids to mask the pain. His fingers were all bent and all this. I'm having it in my middle finger. I'm sorry, I'm having it swollen, and the only thing that I can control the swelling is to keep it moving. Because when you move, you see, arthritic basically is the cracking of the cushion, the cartilage, and it bends the joint, it reconnects all the joints, and you have no idea how painful arthritis is. I understood it now because I'm going through it now. I do not know how my father has suffered those days, and I'm not taking steroids. All right. All I need to do is do the right exercise. And that exercise, when I do, it must not cause tendinitis to my wrists. It must not cause tendinitis to other finger joints that it will aggravate to another fingers to suffer arthritis. So there's a dosage. Everything we do, there is a dosage.
Yeah, that's a good example you're giving.
Yeah.
That's a good example.
So
Yes.
it's easy.
Yeah.
You just have to keep on moving with the right dosage. The body is very simple. You need blood to be there. Blood doesn't travel over there, it's gone. Same when cancer metastasis, it needs blood. It gets into the bloodstream, the flow will spread. So blood is very important in the body, and we need to get the blood going to the body, which part that you need to heal.
Can I
That's
have
basically-
clarity on this issue?
Yeah, 1 minute.
Can I
Suraj?
speak?
Yeah, speak.
Sure.
Yes, thank you, sir. Actually, I am a certified personal trainer pursuing. That is the course is being done at Gaio, and I'm very much happy to say that I'm pursuing this particular course for being. I'm a gym owner also. So in this regard, I have a doctor, one Mr. Gokul. He's a neurosurgeon at Indo-American Brain and Spine Hospital at Vaikam. So he's been trained by me. And my question is, if he's pursuing a course like this, how far will it give mileage and knowledge with these inputs of Mr. Lee?
No, who
Can
is
I
doing the
recommend this
course?
particular?
You or the doctor?
You see,
The doctor. The
Okay.
doctor.
The neurosurgeon.
I train many doctors in Malaysia. A
Thank
lot
you.
of the doctors in Malaysia, number one, they themselves are obese. Number two, they themselves are inactive. Number three, they hardly have time to sleep and their food intake is irregular. All right. So basically, these are the doctors, normally young doctors and older ones. So the first thing we do is that we teach them diet strategy. It goes a long way. I think one of the most important things is that when doctors take up this course, the most important component is that they learn how to move. And there is a guide. You see, the doctors always ask, you see, one of my friends, she is an endocrinologist, right? She's a good friend of mine, and she works in the hospital in Shah Alam. She used to tell me, say, Dr. Lee, I'm so sad in my prescription script to my obese patient is just one word: exercise. How to do it, when to do it, what to do, I have no clue. Her name is Dr. Gunawati. She's a dear friend of mine. She's having the problem. So any doctors who learn how to exercise and advise the patient correctly is excellent. I think it's a good thing to do.
Thank you. Thanks, sir.
Yes, sir. Can I have a question?
Yeah, Prashant.
Yes. Good morning, Dr. Lee, as well as Dilip sir and other faculties and the members of our Gaia Fitness Academy. I'm Prashant from Dubai. I'm part of Gaia Fitness Academy. So I have some questions regarding NCDs again. The thing is that, okay, a few of the points already covered. My question is regarding, will you be able to cover some diseases like fibromyalgia, thyroid, and as well as the disc prolapse area?
This prolapse is, of course, it will be covered. Fibromyalgia, I'm not sure yet. What's the other one?
The third one.
And thyroid.
Thyroid. Okay.
Thyroidism.
Well, we will touch thyroid a little bit due to the endocrine system. All right. We talk about it a little bit onto the aspect of obesity, because in obesity there's an intervention program that we do, that we provide 10 steps for the patients to control their weight, control their body fat content. So we do touch on T3 and T4, the hormones that is being affecting the thyroid gland, affecting the body size. Yeah, we do. Not extensively, because I think teaching the exercise part of it will take quite a lot of time, because you have to remember them, you gotta practice them. Yeah, that's. But of course, thyroid, you can always read it through the book, and exercise, clinical exercise physiology will be able to cover it quite comprehensively.
Okay.
I
Thank you,
found
Doctor.
very
In fact,
difficulty.
sorry.
Yeah,
Go ahead.
Okay. Okay. I found very difficulty to manage the clients like who's having fibromyalgia. This thing is that,
Yes.
so at present I have clients with fibromyalgia issues. Okay, thyroid, of course, we can, okay, as part of endocrine system or through exercise, we can have some results. But the thing is, fibromyalgia is most complicated case. And this is the area I would like to know more about it. And also the supplementation. Will we be covering any supplementation regarding this NCDs?
Sorry again, come again.
Diet part of the NCDs. Will be covering?
Yeah.
Yes. Nutrition is very much part of it.
Nutrition also.
Yes.
Oh, yes.
And okay, fine. Fibromyalgia was my question. So what we can do on that?
You see,
I think,
I'm eagerly waiting for that.
well, you see, it is a chronic, long-lasting kind of condition, all right, that causes the patients to be always fatigue and pain here and there. We have to understand that one of the cause of fibromyalgia is that you see, our body is very simple. If I were to put a rattan chair in a room, a new brought in rattan chair in the room, I only want to sit on it. I put it in the room for 1 year. After 1 year, you will see that the rattan that wrap up the frame will start to break, and then the frame will start to be distorted. It is due to 9.8 meters per second we call gravity. Same as us. As you age, we have daily activities that cause you to have shoulder pain, knee pain, all kinds of pain. You have activities due to your career that cause pain. Even if you don't do anything at all, the gravity will start to pull your tissues downwards. 9.8 meters per second at a speed. And that will cause what we call malalignment of the joint. You will see the joint being what we call overused. The joint is not aligned. It causes muscle atrophy on the wrong side. And then you create what we call the ratio of strength and muscular flexibility not balanced, and that starts everything. All right. I wouldn't call you see, every disease that anyone can mention, it could be systemic, it could be part of it. If you talk about systemic, it could be due to so many, and that's not my job. That will be the physician's job. As far as I look into fibromyalgia, I will look into it as a point of the physical part. I approach it that way. So if that doesn't help, then I have to admit that it could be something else, right? It's just like someone sneeze. I wouldn't say that you have nose cancer. I will look into a different approach, and then from there we move from there. So this is how we want to look at conditions presented by your patients.
Thank you, doctor.
I think to extend what Dr. Lee said, there are more than 50 NCDs. We cannot cover all in 5 days, 3 days plus 2 days. But it's a good thing Prashant mentioned this, because, and even many mentions, because there's so many NCDs or similar diseases in India which probably are more prevalent here than elsewhere. But we can always add, Dr. Lee, in fact, I invite him to do a third clinic in certain other aspects of the NCD. So, there's an endless number of series of workshops that we can do. And I think that's the best way to digest the knowledge, implement it on your clients, and then go to the next set of NCD. So I think it's a good question, Prashant. Thank you. And finally, we come to the last 5 minutes. We are already 3 minutes late. Any other questions?
Sir,
Hello,
one
sir. I
minute.
got a question right now. Excuse me, sir. Does this course have the international accreditation, the certification regarding this?
Exercise medicine has spread across Europe extensively. I have an international scientific committee that looks into our program called the World Conference on Exercise Medicine. And we hosted 6 of it. The 6th was held in Hyderabad. Recently, someone in Delhi wanted to host a 7th, but I don't think it's possible because one of the state ministers wants to host it. And Finland wanted to do it, Hungary wants to do it, Milan wants to do it. So we have that World Conference on Exercise Medicine, and is being monitored by the International Scientific Committee, where we have 17 countries involved. Now, end of the day, it all depends on how we want to regulate it. We have conducted a program in the Ministry of Health that once you are being certified as an exercise specialist, we will have to review you every 2 years. That's what I do in Malaysia. Every 2 years, all those who have received and passed the assessment will come back for a review. If they don't come back for a review, they will have to pick up certain number of CPD points to qualify the extension of the certificate. That's what we do in Malaysia. As far as this course is concerned, we have just formed the International Society on Exercise Medicine. I think I've spoken to Mr. Dilip, but we have not extensively worked on that because I'm really extensively, tremendously occupied. So, but I have a committee looking into it now. Whether it is recognized overseas or not, but there are 45 countries has been exposed to our exercise medicine, and they are working on that too. We have Taiwan working on it very well. We have Milan working on it very well. We have Hungary, of course, doing it very well. Slovakia, and we have Slovenia, UK, a few today. So depending on where you want to go, some of the countries have problems setting up their association. So I'm still trying to find a good model to work on as far as this is concerned. Maybe, Doctor, you can help us to look into this. I'm more than happy if someone can come in here and say, "Hey, come, let's do this," because right now everything is on our shoulder because it's the College of Exercise Medicine, and
Got it.
Sir, I am VM Bashir. May I ask a point?
Yeah, please go ahead.
Sir, some students asked about, I know as Dilip sir told already, we cannot include every subject 5 days. But some students asked about the infertility related to our present lifestyle and obese. Shall you cover anything about in this? I think time will be an issue.
Obesity?
No, infertility, no?
Oh, no.
No, that's not part of the...
I have to tell you 2 cases, all right? I used to do a lot of corporate programs. And in the corporate programs, we see a lot of people. I work for the central bank, and also I work for another bank, commercial bank. And that was a couple of years ago. I don't do that anymore because I'm fully occupied. So what happened was that 2 ladies were unable to conceive because of hormonal imbalance due to obesity developed over the years. And after the program, I couldn't recognize them at all because they have lost weight. They have lost a lot of body fat. We work on body fat. And a couple of months later, they sent me a card of them holding their baby, their firstborn.
No.
So how is it? I don't know. But their doctor, their obgyn did mention that the exercise does help. I have no idea on infertility or fertility. But there are some papers that says that how exercise can balance the hormonal structure of the human body and creates fertility. Quote. Not an expert in that.
That's a
No doubt.
good point.
No
Yes,
doubt
I
I
think
find children
Hello, hello.
myself.
Excuse me, sir. Hello.
Yeah.
Hello, sir. Sir, good morning. It's me, Bijiraj from Bangalore.
Hi.
I have a question. Yeah, the time issue is there. I know that. Good morning for all of them. If you touch any, at least touching about the PCOD or PCOS regarding that,
Sorry. Do
about
I?
the PCOD and PCOS, PCOD and PCOS. Do you
PCOD,
have any?
polycystic
Yes,
ovarian
PCOD and
disease.
Yeah, and
What is this?
PCOD and PCOS. We are touching there.
Dr. Lee, he is asking whether our course in Bangalore will touch upon the issue of
No.
PCOD.
I'm doing in Thrissur only. I'm working in Bangalore.
Thrissur,
Sir.
okay.
Okay. Yeah.
Okay, so will the cover, whether in Thrissur or Bangalore, this gentleman Bijuraj wants to know whether you will be covering PCODs or management of PCOD,
Oh, OCD.
polycystic ovarian disease.
Oh, no.
No.
Okay. Understood.
Okay.
Okay, sir. Thank you, doctor.
So
Okay,
Dilip sir, one more concern. Is it possible or is it not possible to keep the theory of lectures, theory lectures online? That is, it's like a hybrid thing I'm suggesting, and a limited number of days offline. Can we go like that, this course?
Yes,
Dr.
in fact,
Lee. Yes,
Dr.
Doc.
In fact, Dilip has given me an extremely good idea on that. And I was working with my colleague last night, and we have actually successfully segregate the theory, which is going to be online, and we will meet on a certain date where we have to look into the assessment protocol, the training protocol, the prescription protocol, and so forth. So yes, I think I'm going to try it in October when I'm going back to Hungary to run a program with the PhD students. So it is possible. It's possible. Mr. Dilip has given me the idea. We have tried. We are working on that.
Thank you, sir.
Thank you. That's a wonderful thing. Anything? Last two questions. One from
Sir,
Guwahati,
I have.
Assam. One
Yeah,
from
he
Assam,
wants-
one from Bangalore. Is that Rudra?
Sir, I have a question.
Yeah.
So good morning, doctor. I'm Rudreshwari from Bangalore. I'm a part of GaiaFit. So I am representing a question from my students. So they are asking, most of the exercise medicine courses are benefiting special trainers, also the strength and conditioning coaches. But how it is going to benefit the physiotherapist? That is the question most of the students are getting right now.
Now, when I presented exercise medicine about 15 years ago, the main concern of the Ministry of Health was that I am intruding into the territorial of physiotherapists. So what they did was that they invited the entire country's senior physiotherapists to listen to what exercise medicine is all about. They gave us a blessing because of one point. I told them, if you have learned exercise medicine and teach people how to exercise with the right dose, you are not only doing rehabilitative process, you are doing a treatment or an intervention procedure. Because doctors do not treat NCDs patients. They just give drugs continuously every time when the patient comes back. But if you have learned exercise medicine, you will treat them with exercise. And physiotherapists will have an extra knowledge learning the treatment and the intervention part, apart from what we call their duty as a rehabilitationist. So of course, it benefits them tremendously. That's how the Physiotherapists Association of Malaysia, they have given us they have no, what we call, nothing against our discipline here. They accepted us into the Ministry of Health. And we're working closely together because when a patient comes in, sometimes they're not only coming due to underlying conditions, they have some musculoskeletal conditions which they require electrotherapy, and we refer to them. It does very well.
Yeah, see, the thing is, Rudra, what happens is physiotherapists are good at rehabilitation, rehab,
Yeah.
right?
Yes.
But they are not very familiar with the exercise part of it. Fitness
Yes, sir.
assessment, everybody can do. I mean, they can do a diagnosis, but once they do the diagnosis, what is the prescription of exercise
Yes.
in terms of the right dosage? Physiotherapists will not be able to do it. So it makes sense for them to attend this particular course. And the last question, finally, the last single question. Anybody? Anshuman, are you there? Someone to represent Northeast India? We have had Kerala, Bangalore, Dubai, and of course now, nice to see you.
Yes,
Dr.
sir,
Lee,
I'm-
Anshuman is one of our senior most fitness professional, brilliant nutritionist,
Oh.
strength trainer, and he coaches his Assam state in kettlebells, and they're the national champions, God knows for how many years, many years. Yeah, Anshuman, go ahead.
Sir, yes, sir. Good morning, everyone. And I don't have any question as such, but it was a great pleasure listening to Dr. Lee and everyone. And I'm really looking forward to this course because I think it's something which is going to benefit everyone, I think, and it's something that is the need of the hour. And as the doctor said, NCDs are the biggest killers in the planet as of now. And if as fitness professionals, we can counter them with a scientific methodology, I think there's nothing like that. And I'm really looking forward to the course and looking forward to meeting doctors as well.
Oh, wonderful.
Me too.
So Guwahati also is open now to us. So let's see how things work out. Thank you, Anshuman. Thank you so much. So I think to quickly summarize, well, first and foremost, Dr. Lee, you have given me a lot of your valuable time. Others also have given a lot of their valuable time on a Monday morning. But I thought this was a wonderful way of clearing the Monday morning blues, as they say, But it's a nice thing that you have had this discussion. People will hopefully understand what exercise medicine is. It is not the same as an online course. It's far more physical, far more practical in that sense. And the unique features are you really learn to do how to prescribe the dosage. And it's something which normally personal trainers or even PET, physical education teachers, normally do not undergo that dosage or the prescription part of it, except in the case of a normal adult, But here, basically, it was in the context of special populations. And then, of course, as so many of you asked questions, there are so many NCDs, so many illnesses, so many other medical conditions, which could be covered over a period of time, but not necessarily in this one course, which has now been split into 2 courses. But hopefully, if the response is good, and I think India needs that. India, by the way, Dr. Lee knows that. I mean, you mentioned about Malaysia being an aging population. India, 65% of a population of 1.4 billion is below the age of 35. But the percentage of NCDs is mind-boggling. We can have countries as diabetics or arthritis patients or cancer patients. We can have countries of these populations in India itself. So this is very timely, topical. And most important, I think what we discussed in our discussions, earlier discussions, one thing I want to tell everybody here, by doing this course, what are the benefits? Most importantly, the personal trainer has the confidence and the certification to work with doctors. Understand what a doctor there does. For example, when Dr. Lee teaches us how to analyze electrocardiogram, ECG, you are in a better position to discuss these things with the doctors. You are opening your clientele, opening your market, and definitely far better income opportunities than what exists now. So I think that's one salient takeaway from this entire thing. Those who attend these clinics will be able to work effectively with special populations. A lot of people tell me, sir, your Gaio Fitness Academy personal trainer course has a module of special populations. We are doing very well. But I think as we don't really focus that much on special population. We are that is a personal trainer course. While Dr. Lee's exercise medicine program is specially meant only for special populations, right? So we look at it from a personal training point of view. And here we are looking at it as if you are the doctor, as he rightly said, So these are the takeaways from today's seminar. Thank you, Dr. Lee. God bless you. And we hope to see you soon. Thank you, Mini, Rudra, Dr. Bashir, sir, Anshuman, and all the rest. Thank you so much for making this a success.
Thank you.
Thank you so much. God
Thank you,
bless
sir.
Looking forward to
Thank you,
see you.
sir.
Bye-bye.
Thank you, sir.
Bye-bye.
Thank you.